I think there is a view to say that that rate would definitely go below 1 if you had more intense restrictions. But the question is whether or not people would be prepared to abide by those, because you can put the restrictions in place, but of course if people don't follow them, then obviously they're going to be of limited value. So it's judging the ability of people to comply with restrictions, having had to go through this over quite a long period of time already.
Due to the lag period in COVID data, Professor Hall has said it will not be known for at least 2 weeks whether the new tier systems for local lockdowns, which have been formalised by government today, will be effective or not.
The impact of those restrictions will only be apparent after they've been in place for a couple of weeks, when we start to see where the new case numbers drop. There's always a lag period between the cases in the community, admissions to hospital, and indeed deaths. So depending on which of those metrics you look at, there will be a different time phasing. But what you would hope is if the restrictions are effective, you start to see a reduction in the number of new cases in about 2 weeks' time.
The City of Nottingham still has the highest rate of COVID cases in the country. Although the majority of cases are among young people, hospital admissions for older people are on the rise.
I think there's about 60,000 students in total in Nottingham, so it's not surprising that the rates look pretty high here. Having said that, then we are starting to see a rise in hospital admissions amongst people in older categories. So whether it's spread directly from the younger population, or whether it's low levels of transmission which are starting to pick up in the more elderly population, I'm not completely sure. It's probably a mixture of those things, to be honest.
When asked about a COVID vaccine, Professor Hall said he believes the first results of the Oxford study, where a vaccine has been given to thousands of participants to check its effectiveness and safety, will be known around Christmas time, and that if it doesn't work, there are other vaccines in development. He said there will be tough times ahead for the next few weeks, but that it will not last forever.
I get the feeling people are quite cross at the moment because they think things are uncoordinated, and also that nobody wants to go back into additional restrictions, and people are worried about jobs, etc. But this will all go away in due course, and we're not there yet, but there will be better times ahead.
Jake Brigstock reporting for Notts TV.